Today's numbers are, to be frank, they are scary. The raw number of cases is over 4,000. There are some cases that were from a few days ago that were included, so it's probably around 3,800. But it's very high. It's going the wrong way. We have more and more people hospitalized, more and more people in ICU, more and more people on ventilators. The hospitals are starting to have to cut back on elective surgeries and other very important procedures that require ICU care. They're starting to have to move patients between hospitals, cut off elective procedures, and we have more and more outbreaks in congregate care, particularly long-term care. We have increased rates of infectivity, of positivity, even in children now. Since the middle to the end of December, the percentage of positive children went up dramatically. So what we're seeing is there is more and more spread of this infection in the community. We also have the mutation of the virus. There's the UK variant, B117. We have had 6 cases identified in Ontario. We're doing way more testing to look for it. There's probably more that we don't know about. What we do know about that variant is it is more contagious. It's been shown to be about 56% more contagious between people. So if we get a case, we've been pretty lucky so far as we know, the cases have been in people who recently traveled to the UK or were a close contact of a traveler, and they have maintained their quarantine. We may not be so lucky in the future. There's the South African variant. So we are in a very serious situation. We need to consider all possible measures to contain this infection. We don't want more people dying. We don't want the ICUs overwhelmed. We don't want morgues overwhelmed. And I know we don't want to scare people, but on the other hand, I think there's too much complacency. And I understand it. We're tired. It's been a long time. You know, people are sick and tired of the whole thing. They may not know anyone who's become ill. But believe me, although it tends to affect more older people, it does affect younger people too. And, you know, everybody's got people in their family. We want to keep people healthy and safe. So please stick to the measures. But I will say, as we look at the modeling, we are going to be, through the public health measures team, with input from the medical officers of health across the province, I think we do need to consider more serious measures, perhaps similar to what happened in the spring, and looking at other jurisdictions, what they have done and what has worked, so that we can get ourselves out of this with the light at the end of the tunnel as we vaccinate more and more people.